Hello, it's Dr. Lewerenz at Longevity Health Institute, and today at my original office, Lewerenz Medical Center. All the same, we do all the same of good, functional, integrative, personalized medicine. You've heard me talk about this before, so hopefully you've seen a video similar to this, so you got some education based on your immune system and gut health and diet. But I want to share a few stories with you because just today, even over my shoulder here, you're seeing someone's live blood, and that pretty, what looks like maybe abstract art, it's actually somebody's blood. And I'll explain that in a minute. But let me share with you a couple stories about a couple patients today, so this is fresh in my mind, about the impact in someone's immune system and their diet at their gut level, and really where you can really impact autoimmune disease, okay? So, topic here being any autoimmune disease, whether it's celiac, rheumatoid arthritis, lupus. A patient today I saw, which is called ITP, idiopathic thrombocytic purpura, which is a blood disorder, a bleeding disorder potentially where you have low platelets. And low platelets obviously can give you a big issue with potentially bleeding and literally internal bleeding and some high risk, even deadly occurrences. But any autoimmune disease, anything you can think of or know of, or unfortunately possibly maybe something you have, Raynaud's, celiac, like I said, Crohn's, ulcerative colitis, any of these. The basis of an autoimmune response starts at the gut, starts at the lining of the epithelium in your gut. So that has to be good. But let me tell you a couple stories. So I have a patient with a really rare autoimmune condition, and today just saw her back, and she is having trouble. She has a lupus-like, if you will, autoimmune condition, and she was having trouble walking, using a walker, barely getting out of bed. And of course, we took our full functional, personalized medical approach to her, where we look at a lot of root causes, but also some systems in the body where you can't ignore physiology, meaning hormones and nutrients and how you detoxify and such. And of course, we're improving all those. So those are making a difference. But the other big thing is we got her gut on track. And we got her gluten-free and removed food sensitivities, used some things that are supplements that build the gut lining, okay? And when you build and regenerate the gut lining, obviously your immune system gets better, okay? And things get more stable, all right? In that particular person, we used even a peptide called BPC 157, which actually helps regenerate the lining and can help heal even ulcers and gut stuff. So long story short, saw her back today, that's why it's fresh on my mind, and she actually had some drastic improvement with movement. She's not using her walker, first time I've ever seen her not use her walker, and she was much more mobile, less pain, and she's only 45 years old, so we're not talking about somebody that we would expect to have immobility issues. So anyway, big improvement in her gut health, and thus I think she's getting better. The other patient I saw today, it was an autoimmune condition called ITP, idiopathic thrombocytic purpura. ITP, fairly rare, yet it is not uncommon, and we have probably at least 100 patients or so here with it, and very manageable. But what do you do to influence the immune system? A lot of that, like I said, gets based on the gut health, even if it's autoimmune like ITP. So that syndrome of low platelets and platelet production can absolutely get better when you build the integrity of your digestive lining, okay? So that your Th1, Th2 immune system is more optimal, so that the good guys like your probiotics and prebiotics and fiber and good bacteria in your gut stay there, including the yeast that is there. That's normal, but it should be in your gut, not in your bloodstream, not causing your immune system to shift against if you will, a foreign body, okay? And so in this patient that we removed food sensitivities, used the appropriate amino acids and immunoglobulin and the right probiotics, and we've tracked and watched her, and we looked at her blood on the microscope and followed her live blood, okay? She actually, her platelets have gone more than 3 times up. She was around the 50,000 platelets, and now she's over the 150,000. The bleeding risk is under 70,000. So she is making huge improvements, feels a lot better, but from an immune, scary kind of standpoint with bleeding disorder like that, she's actually getting much better platelet production and doing much, much better. Now, what's over my shoulder here is, and this is all in one day, that's how important diet and gut is. Okay, and even no one here is perfect. I'm not perfect, as far as diet and all that, but the better on point we can be with our diet and non-processed and, things that are not feeding yeast like sugars and processed sugars and, gluten-free or at least the least gluten possible, dairy-free, you then aren't aggravating your immune system. And it's about a balance, okay? You got to be balanced. I do get that, and you got to live, okay? I hate to handcuff people in things in life that they might enjoy, but you got to be realistic if it's affecting your immune system. So this person here that I've seen her for probably a couple of years, she's one of my concierge patients, does very well, very dedicated, has some skin issues, has a autoimmune condition that is often minimized or, if you will, underappreciated, and that's eczema, dry skin patches, especially worse in the winter and months and all that. That is autoimmune, okay? And so we've always worked on her gut, and she does much better than she ever was and feels great, and we've got some hormones balanced in her, etc. But she came in just for a follow-up recheck about 4 months out and feels good, but she goes, man, weird. I don't know if it's this season, this winter, which we've had a very mild winter and lay-bow winter. And so she's like, but man, my sinuses, I'm draining, my eyes even itch a bit. I don't know if I'm developing allergies. But it's weird because, I'm gluten-free and I'm eating pretty good. And, the holidays, maybe I had a glass of wine or some sugar, but not much. And I'm taking my probiotics, I'm doing everything. So long story short is, let's look at your live blood. Let's compare your previous live blood. So that's what you're looking at over my shoulder, and I'm sure you've seen this in some other my videos here. If you subscribe, not the first time I've talked about this, but this is her live blood. Now, this is really impressive, and that's why I wanted to show you. So this is somebody's blood, not abstract art. And your live blood, actually, we do look at the parts also that are dry, and this is somebody's dry blood. So this is 1 drop of blood, okay? And when you have big inflammatory reactions like this, where somebody's blood actually does this separation. So if you will, I'm going to show you a picture of what is normal blood when it's non-inflamed. You don't have immune responses in it, and your blood is healthy and rich, and your immune system is stable, and it just looks red like that, just solid like a desert, like red like that. When the blood separates like that, that is because in the blood, and this is 1 drop of blood, the blood on the slide is separated because of antibodies, because of an immune response and inflammation in the body, okay? And this is actually very profound. Sometimes we'll see a few spots, a few separations, but we're like, whoa, pump the brakes. Yeah, it's pretty, but it's also pretty impressive that she had that big of a issue going on. She was shocked, I was shocked, and my point being here is that what do? Well, we drew her food sensitivity panel, and we're going to test her food allergies and IgE and sensitivities and IgG, and we'll see what she's reacting to. Now, to recap, mind you, she's gluten-free, taking probiotics, doing things in the past for her gut because of her eczema, but she still got this. So what would do this? What would cause this? And that's the part I want to share with you. So, we recap her history and what's been going on the last few months. Obviously, because of business and what she does, and with COVID and some stressors, and the holidays get really busy at work for her and are stressful. Stress plays a role. When you have stress, you actually melt down and kind of break down your mucinin in your digestive system, and that is a protective lining. So that alone can't give you something like this, but it does make you more susceptible. So if you had any history of digestive issues or trouble, you are prone then to developing a food sensitivity and a reaction like this. And so in her, I think that is a culprit. That is one of the problems. The other thing is, though, is that she did indulge. She had more carbs, a little bit of sugar, a little bit of wine, nothing much, but that feeds the yeast that then creates an inflammatory and immune response like this, okay? And the other thing is, and ironically, I caught this because she was here with her children and they were complaining about dinner tonight, which I thought was so funny because I said, don't complain, your mom's making you dinner, so you better be grateful, at least, so, and I said, and the complaint was, we always eat the same thing. Well, that's my point here. So when you have leaky gut and you have a gut barrier issue here, okay, what happens is that the more you put in your system and diet-wise, so repetitively, could be anything, nuts, chicken, eggs, seafood, doesn't matter what it is. If that's what you love and you're eating a lot of it, okay, and you have leaky gut, eventually that will cross the digestive barrier and create an inflammatory endotoxin immune reaction. And your immune response and your antibody response build. So the first time you get that response, it's mild, and the next time it's higher, and the next time it's higher. And what happens is, and we're all a little different, whether it shows up on our skin, whether it shows up in a rash, whether it shows up in my stomach, bloats and doesn't feel good. And in her case, it caused her to have an environmental allergic response. So I think she's really reacting to our unstable weather because her immune system from the gut level, or Th1, Th2 immunity, is way off, okay? So of course, what do? We're gonna draw her food sensitivities, obviously eventually eliminate those. I recommended, a little bit maybe higher dose probiotics right now and start making food varieties. If you like chicken and you eat that a lot, maybe you have it every third day or fourth day, not daily or twice a day. Mix it up a bit. Still be gluten-free, but mix it up a bit, because when we have the repetitive same foods, even if they're healthy, if you have leaky gut, you're going to start reacting to those, then those create an immune response, okay? So this was very interesting because, and I can do a follow-up on this case because it's so dramatic, is she's going to probably show some significant food sensitivities and allergies. So, and yes, in our COVID times and our worry about our immune system, what is the smartest thing you can do besides take some good supplements like zinc and vitamin D and vitamin C? Build your gut health, fix your digestive lining, take good probiotics. We have them on our website, and you've heard me talk about this before, good quality live multi-strain probiotics. And I love the one for yeast called Saccharomyces boulardii, which is in one that I actually helped formulate. And why is because it's so beneficial and helps so many patients here for so many years. I'm really a firm believer, besides the science behind it, I see it here clinically, okay? But you want to prevent COVID-19 or minimize it, the effects you get, or flu, or just sinusitis or environmental allergies like this patient, okay? You build your gut system, you build your digestive lining, okay? So hopefully this is enlightening, helpful, and kind of entertaining and actually pretty. So this was a couple good cases today, and I thought I'd share with you. So subscribe to my channel. If you don't already, share with others. We do consults around the country and bring you the best and functional personalized medicine, whether it's hormones, whether it's gut health and immune system, whether it's genetics or detox. It's bringing you the best health and optimal care possible so that you can thrive and not just survive. The best thing I feel best about in our practice is when patients come back and, give us a hug or say thanks and say, wow, man, I've caught my life back. I'm living fully and enthusiastically and lovingly. And hey, by the way, I sent some friends and family. That's the best compliment we ever get. And just love to do good work here. So this is Dr. Lewerenz. Be well and do the right thing. Take care.